Looking back at myself from my very first day of placement, and I was an absolute wreck of nerves, and comparing myself to now being in third year, the skills I've gained is just incredible. Both, I think communication is kind of the biggest one. Like, I would have been very quiet coming into college, and I'm not from Cork, so coming up to a new environment was scary enough. But I think going into the hospital, coming into college, and like just meeting so many people and having to be able to speak inside nursing is just, it really helped. And on top of that, definitely confidence as well. I would never have been able to speak in front of a crowd of people, but now I have no problem doing it. And I suppose just like being able to think on your feet as well is one of the biggest things I've definitely learned going in, you know, knowing what you have to do when you walk into the hospital, and just knowing how to speak to a patient is definitely the biggest part of nursing as well. And you learn that over the 4 years, and every day you're kind of learning a new skill as well.
The best part of my job is welcoming new life into this world. The event of birth is a highly intimate and precious moment in life, and I count it an honor and a privilege to be welcomed on that journey by mothers and their partners.
Well, the mental health program here in UCC, from what I've experienced, is definitely what you're learning in class is how to be a nurse in theory. So fundamentals of looking after service users and looking out for their safety, liaising with other departments of health to like basically kind of push their best interests forward as much as possible, and you're advocating for them. And your quality of practice then is based on evidence-based practice. So obviously what goes on here in the college, there's a lot of research there. So we kind of know what we're doing and why we're doing it, which is kind of unbelievably important. Like, and it gives us a bit of safety as nurses as well in what we're doing. So there's that in the college, but I think what you learn out in placement is not really textbook kind of, well, you find it in journals and textbooks, but it's really learned by doing it, just by plain listening and actually being in front of people and talking to people and things like that. I don't think you can really learn that in the college. So I think UCC have played a good card there and putting a lot of work placements in line as well. And I think all around of all of that, of all the kind of practical experience and all the kind of theory, if you combine them together, that's the mental health program is to me, and you'll be the best nurse you can.
So I suppose being on the intellectual disability program here in UCC and being out on clinical placement, I've had the privilege of supporting people that may have sensory issues, getting to hospital appointments, maybe even socialising in the community. And during my placement in first year, I got to take somebody that had a lot of sensory issues to Funderland here in Cork.
Well, definitely I'm really glad to study at UCC. The first thing, and also is the reason I choose here, because our university has very good reputation in international. So which indicates we have the excellent education resource. And secondly, my classroom experience was enriched by the fact that I met some professors and classmates from different culture, and they have different areas of specialized. So they have the nice studying atmosphere here.
I think I'm very glad that I'm in general nursing, because it's something is in me. It's something I love doing. I have the passion for it. And because right from when I was small, when we were doing role play, I always like to take the part of a nurse. I like seeing, attend to a patient and they get well and discharge, even in the role play. So I enjoyed it easily, and I love general nursing.
I am glad that I've chosen to go down nursing. The funny thing is, if you had asked me back when I was like 13, 14, going to secondary school, if nursing or medicine of any kind was for me, I would have said absolutely not. I wanted to be a baker, I wanted to dance, and then something just clicked one day, and I thought helping people. Like that was the big thing, helping people and just being there for them. You hear stories of people being overlooked and not listened to, and the foundation of this journey for me and the core of it is making sure that they are heard, that they know that I'm the one who's listening, and I'll make sure that I can help them the best way I can. So that's the big thing for me, so I'm very glad.
I'm very glad to choose nursing. Why? Because nursing first is a rewarding job. So everywhere I go, I can just like, oh, I'm a nurse and I can work. In case there is something happen, like accident, I can volunteer to help the person. So that is something that I really care about people, their well-being. So that's why I chose nursing, just for the well-being of people, how caring for people. and let them to get better and go back to their family.